I think whatever feelings you're having, the most important thing to remember is that they're normal. Caregivers feel stressed out, unhappy, angry at their loved ones, sad, afraid, lonely. Those are all normal reactions to be having to the stress of caregiving. The most important thing is to realize that these emotions are completely normal and that you talk to people about the feelings that you're having. Caregivers can get burned out for lots of reasons. It's the physical toll of caring for someone, whether it's the day-to-day hands-on care for someone at home, or if they're in the hospital, it's the coming back and forth every day and spending long days in the hospital. It's asking all the questions, it's the long hours of caring for your loved one, and then of course the general stress, emotional sadness, and fears about going through serious illness with a loved one.
There's a whole literature around caregiver burnout, and when you look at it, it talks about things like taking care of yourself, making sure that you're eating, making sure that you do some exercise, the idea possibly of moments of relaxation where even if you just take 5 minutes, that can be very helpful in terms of replenishing.
But if you don't take care of yourself, you're not going to be able to take care of your loved one. So if you have questions or concerns or fears, or you're just not happy with the care that your loved one is getting, you should talk to a member of the healthcare team and ask those questions.
The information that a caregiver has about a patient, the doctor will never be able to capture, or the care team, it's not just a doctor, oftentimes it's a care team, not be able to capture in the 10 or 15 minutes they spend together. So keeping a diary, a journal of some of the things that happen with the person, I think is really useful because it's a focused way of sharing the progression of what's happening with the patient, and also identifying the areas that you need help with that people often forget when they go to the doctor's office because the time is limited. And not only is the time limited, but often people are anxious when they go to the doctor's office, so stuff goes right out the window.
The biggest concern that we see is when caregivers don't take any breaks at all and are with patients all the time in the hospital. And there can be consequences to not taking care of yourself. Sometimes that we see that caregivers, they may forget to give medications, they may forget things like scheduling doctor's appointments. And so not taking care of yourself can have serious consequences on the patient as well as on your own long-term health.